In this video, we'll take a look at patient teaching and complications that may arise with IV therapy. These are the learning objectives we will cover. I mentioned briefly in the last video on IV insertion the importance of taking the time, if possible, to discuss the need for an IV with your patients and to gain their verbal consent. I want to take a few minutes to look a little more at what specific things should be included in patient teaching prior to and following IV insertion. Prior to insertion, taking a few moments to explain and talk through the process will likely help your patients to be more relaxed and more cooperative during the insertion. Make sure to talk about why you want to start an IV. Because they are so tired and dehydrated? Because the baby's heartbeat is dropping and you are concerned? Because she's bleeding more than normal? In your mind, it may be clear why an IV is indicated, but it may not be clear to your patient, so take a moment to explain. Not everyone may know and be familiar with what an IV is, so it is always good to explore that and to provide education regarding that, as well as what solution you're going to use and what is in it. You don't want a patient to be terrified of moving her arm after you start an IV because she thinks you've left a large sharp needle in there. Prepare your patients for IV insertion by telling them what to expect. Let them know to expect a little pain with the insertion itself, but then assure them that it shouldn't be painful afterwards. Let them know the fluids may feel cold in their arm, etc. Allow for questions and give your patients an opportunity to voice fears or concerns. Make sure you gain their verbal consent to start an IV. Oftentimes, the need to start an IV may arise in an emergency situation where there's not time to provide much teaching. At least try to quickly inform your patient and/or her family that you're going to start an IV and why, and if possible, seek their verbal consent. It is a good habit to chart what teaching was given, if your patient verbalized an understanding of it, and if you received verbal consent from them to start an IV. After insertion, take a little time to explain about where you place the IV, and let them know if they need to be careful or limit movement of that arm or hand due to the location. Encourage them to be careful with the IV site so as to not accidentally dislodge it. Encourage them to be careful with the tubing to ensure it doesn't become pinched or bent. Teach them about keeping the IV bottle at least 3 feet above the insertion site to help prevent blood from backing up in the tubing. Teach them as well to always keep the IV bottle upright to avoid getting large air bubbles in the tubing. Always teach your patients about things they need to monitor for and notify you of immediately that could indicate a problem with the IV site. Pain, swelling, numbness, redness, etc. It is quite likely that they could identify a problem earlier than you could. There are a variety of things, as we previously talked about, that can affect the drip rate of your IV once you've set it. So it is always good to ask your patients to notify you if they notice the fluid is dripping at a significantly faster or slower rate, or if it stops dripping at all. There are 2 different classifications of complications that can occur with IV insertion and IV therapy. There are local complications, limited to the actual IV insertion site and surrounding area, and there are systemic complications that may affect multiple body systems or the body as a whole. Let's start by looking at some of the most common local complications, beginning with an occlusion. This is when something blocks the flow of fluid through the IV tubing, cannula, or the vein. Signs include a decreased drip rate, an absent drip rate, and sometimes blood backed up in the tubing. Causes include forgetting to remove the tourniquet after insertion, a flow rate that is too slow to prevent the cannula from becoming clogged, pinched tubing, a patient with a high blood pressure, an almost empty IV bag, or an IV bag not positioned high enough above the insertion site, the cannula being too close to a valve, or a blood clot in the cannula preventing the flow of fluid. Prevention has to do with the causes. Make sure you do remove the tourniquet after insertion. Keep the fluid dripping at a steady rate. Teach your patients to be careful with the tubing in order to avoid pinching it. Be aware of the effect an elevated blood pressure can have on the flow rate. Ensure you replace the IV bag before it empties completely. Maintain and teach your patients and their families to maintain the IV bag at least 3 feet above the insertion site at all times. Select good insertion sites away from joints or valves. All of these will help prevent the formation of a blood clot in the cannula. To manage an occlusion, open the roller clamp, elevate the IV bag, and see if the elevation helps the fluid start dripping again. Ensure the tubing hasn't become pinched. Lastly, if all else fails, try flushing the cannula. To do this, gather a 10 cc syringe with a large needle gauge. Using rubbing alcohol, thoroughly clean the injection port that is closest to the IV cannula and insert the needle. Pinch the tubing between the injection port and the cannula and draw back on the syringe plunger to fill the syringe with IV solution from the bag. Unpinch the tubing and pinch it again above the injection port, between the injection port and the bag of IV fluid. Gently apply pressure to the plunger and try to flush the line and cannula with the solution in the syringe. Once you flush the line, your IV drip should resume without a problem once you've unpinched the tubing. If you are unable to flush the cannula with gentle pressure and resolve the occlusion, discontinue the IV and start another if needed, either proximal to the site or in the other arm. An infiltration is the leakage of fluid and/or blood into the tissues surrounding the vein and the insertion site. The most noticeable sign of infiltration is a swelling of the surrounding tissues. If left unnoticed for too long, it can literally swell the whole arm and surrounding area. Generally, healthy and alert patients will notice when it first begins to swell and will let you know. But it is good to assess the IV site frequently, as severe enough swelling can cause significant damage to the surrounding tissues. Other signs of infiltration include discomfort, numbness, discoloration or blanching of the surrounding skin, bruising, and a coldness to touch. Eventually, the IV fluid may stop flowing as well. An infiltration may be caused by an improperly placed cannula, by a cannula becoming displaced, for example through movement, and accidental pulling on the tubing or cannula, or the tape coming undone. It may also be more likely to become dislodged if it was placed over a joint. Or, fragile veins that can't handle the flow of extra fluid through them may cause an infiltration as well. To prevent an infiltration, ensure your cannula is correctly placed and flowing well before you tape it up. Provide good patient teaching to help avoid accidental dislodgements. Teach your patients if there are any movements they need to be cautious of, and teach them to be careful with the IV site and tubing so they don't get accidentally pulled or tugged on. Make sure you tape your cannula well so that it won't move around, and keep your IV site dry so that the tape will stay attached. Retape the IV site if it is needed. If you have to start an IV near or over a joint, consider placing a splint. A splint is placed on the underside of the arm or hand to help prevent that joint from bending and the IV cannula from becoming dislodged. Use some cloth, gauze, or tape to attach the splint to the arm on both sides of the joint, but be careful to not attach it so tightly that you cut off circulation. Lastly, try to avoid fast drip rates if you know your patient has fragile veins. If you notice an infiltration, close the roller clamp and stop the fluids immediately. Discontinue the IV and apply direct pressure to the insertion site for a few minutes. To help with the discomfort later on, you can apply a warm compress, which may help also with the absorption of the extra fluids. Elevating the arm above the level of the heart will also help with the swelling. If an IV is still needed, start one ideally in the other arm, or else significantly proximal to the site of infiltration. A hematoma is basically a bruise caused by a leaking of blood into the tissues. It is a type of infiltration, but related only to blood, not fluid. Signs are similar to an infiltration. They include swelling, bruising, and redness at the insertion site, as well as tenderness to touch. As with infiltration, a hematoma may be caused by injury to the vein from the IV cannula with an unsuccessful IV attempt, from a fragile vein just blowing for one reason or another during or following insertion, or from inadequate pressure being applied after the cannula is removed, resulting in blood collecting in the surrounding tissues. A tourniquet reapplied to the same arm shortly after a removed IV or a failed IV attempt may also result in a hematoma at the old insertion site because of the extra pressure in the vein. To prevent a hematoma, use good technique with IV insertion to avoid injury to the vein. Be aware that the development of a hematoma is more likely with fragile veins. Apply or have someone else apply firm pressure to the insertion site for a few minutes, following a failed insertion or having removed an IV. Or make sure you apply a good pressure bandage. If at all possible, avoid reapplying a tourniquet to the same arm soon after an unsuccessful start or the removal of an IV. If you notice a hematoma and an IV is still in, discontinue it. Apply pressure with a cotton ball or some gauze directly to the puncture site for a few minutes, and then tape it with a pressure bandage. Applying a cold compress may also help to slow the bleeding and stop the hematoma from growing. If an IV is still needed, start one in the other arm or else proximal to the hematoma in the same arm. Let's take a look at these next two complications together. Phlebitis is an inflammation of the vein where the IV is inserted. Thrombophlebitis is an inflammation of the vein where the IV is started, along with the formation of a clot. Medically, a clot is defined as a thrombosis, which is where the thrombo in the thrombophlebitis comes in. One of the classic signs of these two complications is a red streaking of the vein upward from the insertion site, caused by the inflammation. Other signs and symptoms include the vein feeling hard, kind of like a cord, warmth to touch, fever, tenderness, swelling, and irritation to the surrounding skin and tissues. Causes of both of these include the use of irritating IV solutions or harsh medications, such as certain kinds of antibiotics, that are given too fast or are not diluted enough. A break in sterile technique causing the introduction of a microorganism, use of a cannula that is too big for the vein, and/or inflammation from an IV cannula that has been in for too long, or that is in a location where it causes more irritation, such as over a joint. To help prevent these complications, try to avoid the use of irritating IV solutions or the administration of harsh medications, especially undiluted or at fast rates. Carefully maintain sterile technique during the insertion process and cover the site well to decrease the risks of microorganisms being introduced. Ensure you use an IV cannula that is smaller than the size of the vein you want to start it in. Make sure to not leave a cannula in for longer than the recommended period of time, 72 to 96 hours according to the CDC. And be careful to try avoiding insertion over or near a joint if at all possible. For management, as with an infiltration, stop the fluids immediately and discontinue the IV. Apply a dressing, and if an IV is still needed, restart one proximal in a different vein, or more ideally, in the other arm. Applying a warm compress for 15 to 20-minute periods intermittently may also help. Monitor the site closely for signs of infection, drainage, pus, fever, etc. Refer your patient for management with antibiotics if there are signs of an infection. Also refer if you notice signs of a deep vein thrombosis. Just to briefly mention, a few other potential complications that may occur locally, although they happen rarely, include nerve, tendon, or ligament damage. This occurs when a nerve, tendon, or ligament is punctured or injured during the insertion process. Signs include sudden severe shooting pain, and/or numbness at the site or numbness of the whole arm. The most common causes are attempting to start an IV near a joint, or by going too deep into the tissues during the insertion process. So prevention would involve avoiding joints during the IV insertion process, if at all possible, and remembering that veins are located superficially, so you should not be inserting your needle deep into the tissues. If this happens, immediately remove the IV cannula, apply a bandage, and start an IV in the opposite arm if still needed, or significantly proximal to the previous insertion site. If problems, such as numbness, persist, refer to a doctor for further evaluation. Let's move on now to talk about systemic complications. Fluid overload is when too much fluid is administered or too fast, overloading the circulatory system in the body. Most healthy women can handle up to 2 to 3 extra liters of fluid in their body without a problem. However, women who have significant problems with their heart, lungs, or kidneys may not be able to. Signs and symptoms of fluid overload are directly related to the vascular system of the body being overloaded with fluids. They include dyspnea, difficulty breathing, coarse lung sounds, and frothy sputum, all of these due to the fluid buildup within the lungs. Jugular vein distension, the jugular veins are located on the side of the neck, elevated blood pressure, and edema from the body trying to move the fluid out of the intravascular space. Swelling may be especially noticed around the eyes and in the face, and if significant enough swelling occurs, it can result in cerebral edema, swelling of the brain, leading to a change in the woman's level of consciousness. Causes of fluid overload include an unregulated drip rate, one that is not properly set, or an unmonitored drip rate that changes without being noticed. Either of these can lead or contribute to either too much fluid being given or it being given too fast. Other causes include medical problems that decrease a woman's ability to tolerate excess fluids. As we already mentioned, this would be cardiovascular disease having to do with the heart or vascular system, pulmonary disease having to do with the lungs, or renal disease having to do with the kidneys. To prevent fluid overload, ensure you set correct drip rates for your patients and assess the drip rate regularly to ensure the desired rate is maintained. Always keep in mind and consider your patient's medical history. Make sure to note any history of cardiovascular, pulmonary, or renal disease and factor that into your decisions regarding IV therapy. It is a good habit to always keep in mind your patient's intake and output with IV therapy. If you've given a woman in labor 2 liters of fluid and she hasn't used the bathroom once, that is something to be concerned about. On the other hand, if a woman has just hemorrhaged 1,000 cc's, then giving her 1 to 2 liters of IV fluid rapidly will not likely cause fluid overload. So what do you do if you suspect fluid overload in your patient? First of all, stop the IV, or at least slow the IV drip down to a minimum rate in order to keep the line and the cannula from becoming occluded. Elevate the woman's head, as this will help to prevent fluid from building up in her lungs and will help her to breathe easier. Give oxygen by mask or nasal cannula. Because of the fluid building up in her lungs, she isn't going to be getting as much oxygen into her bloodstream, so giving a little extra will help. Monitor her vital signs closely as well as her respiratory effort. Consider if transport is needed. Medications may be required to help reduce her circulatory volume. Pulmonary embolism is one of the most severe and life-threatening complications that can happen with IV therapy. This is when blood flow through a blood vessel in the lungs, oftentimes one of the main arteries, is physically blocked or plugged by something, preventing the flow of blood and oxygen to a portion of the lungs. Signs and symptoms include sharp pain where the clot becomes lodged, painful breathing, respiratory distress, unequal breath sounds, cyanosis, blueness of the nail beds, lips, mucous membranes, and skin because of blood not being oxygenated well, signs of shock, rapid and weak pulse, cold clammy skin, rapid and shallow respirations, etc., and the loss of consciousness if it becomes severe enough due to decreased oxygen to the brain. If the problem persists, a patient may go into respiratory arrest and stop breathing altogether. Specific to IV therapy, A pulmonary embolism could be caused by one of three things: a blood clot, air, or a foreign body. Let's take a brief look at each one of these, starting with blood clots. In relation to IV therapy, a blood clot is likely to be caused by one of two things. The first is from thrombophlebitis at the insertion site, which we just talked about. A thrombosis, or clot, formed at the IV site, may break off and make its way to the heart and lungs, causing a pulmonary embolism. The second is from a blood clot developing within the heart as a result of air. This blood clot in the heart can then move into the lungs and cause a pulmonary embolism. Let's move on to looking at air and take a closer look at this. Most healthy adults can tolerate up to 100 to 200 cc's of air in their circulatory system without significant problems. But women who are ill or compromised in some way, for example, someone in shock from hemorrhage, may be affected even by a smaller amount of air introduced into their circulatory system through IV therapy. Just to give you an idea of the amount of air we are talking about, it generally takes at least 20 cc's of air to cause a problem. The typical macrodrip IV tubing, 68 inches in length, holds approximately 8 cc's of fluid or air. So we are talking about, at minimum, several IV tubing lengths of air, not just a few small air bubbles in the tubing. Too much air in the circulatory system, or too much in a person who is compromised, causes the blood to become foamy when it is agitated within the heart. If enough air builds up in the heart cannot pump as effectively, and blood flow out of the heart to the rest of the body is decreased. This by itself causes significant problems within the body. It may also lead, though, to the formation of blood clots within the heart. A blood clot may then make its way to the lungs and cause a pulmonary embolism. The most common way for air to enter the circulatory system in relation to IV therapy is through the use of unprimed tubing that has not been flushed with the solution prior to use. Damage to the IV tubing or bag may also allow for air to be drawn in. Not filling up the drip chamber of the tubing may allow for air bubbles to be drawn into the tubing with the fluid. And an IV bag that runs out without being noticed, especially certain types of bags, may draw air into the tubing and into the circulation after the fluid. Lastly, let's take a look at foreign bodies. Specifically in relation to IV therapy, a foreign body embolism would most likely be caused by a piece of the IV cannula becoming sheared off during the insertion process, making its way through the body to the heart and the lungs. Prevention of pulmonary embolisms has to do with the specific causes. To prevent a blood clot from causing a pulmonary embolism, monitor the IV site carefully for early signs of thrombophlebitis and manage it appropriately. To prevent air from causing a pulmonary embolism, make sure you always prime your tubing, flush it with fluid. Ensure your drip chamber is always filled 1/3 to 1/2 of the way full. Ensure the tubing and IV bag are undamaged before use. And always close the roller clamp and discontinue or change out an IV bag before it is completely empty. To prevent a foreign body from causing a pulmonary embolism, never pull the IV cannula back onto the needle after advancing it into the vein, or you risk shearing off a piece of it in the process. Always check your IV cannula when you remove it to ensure that it is intact. If a piece is noted to be missing when you remove it, you would want to transport the woman immediately to the hospital, where measures could be taken to perhaps help prevent it from becoming lodged in the lungs. If you suspect an air embolism as the cause, stop the IV drip and quickly check or have someone check the tubing and bag for damage or for anything allowing air to leak in. Once a leak is ruled out, IV therapy may be used to help stabilize the woman's vital signs. Turn the woman onto her left side. This is a very important step, especially if the cause is an air embolism. If there is air in the heart, putting the woman on her left side helps to keep the air on the right side of the heart, away from the heart valves. This also helps maximize oxygen flow to the baby if the woman is still pregnant. Regardless of the cause of the embolism, administer oxygen at a high flow rate through a mask if one is available. Transport your patient immediately to the hospital. Be prepared to perform resuscitation if a woman stops breathing. Most of these complications that we've looked at are rare, but some of them can be quite serious and even life-threatening. Always make sure you keep them in mind and monitor for them in a patient receiving IV therapy. Remember, prevention is best. If you encounter any of these complications with IV therapy, always chart what complication occurred, your management of it, as well as any follow-up.